In your analysis, you identified either a anterior pelvic tilt, where your tailbone is higher than your pubic bone, or a posterior pelvic tilt, where your pubic bone is higher than your tailbone. If you identified you had a level pelvis, you don't need to pay attention to this particular step. If, however, you notice that you have an anterior pelvic tilt, where that tailbone is higher than the pubic bone and you have an increased arch in your back, and or back pain is aggravated with extension, leaning backwards or increasing the arch in your back, you're going to maintain a slight tail under or pubic bone up, posterior tilt, flattening that arch in your back with abdominal tension. And you're going to maintain that especially as the leg moves behind you. At the beginning, this may be difficult, so you need to shorten your stride so you're not allowing your leg to move back as far. But as time goes on, you want to try to increase the ability to hold that spine in the neutral position that you've identified in earlier chapters as the leg moves further and further back, avoiding that extension of your back or increased arch and or the anterior pelvic tilt. Conversely, if you have a problem where you have a posterior pelvic tilt and flexion or bending forward aggravates your lower back pain, you're going to want to maintain a little bit of an extra arch in your back. Increasing the slight arch in your back actually decreases your pain. You want to maintain that especially as the leg comes forward. Typically, as you step forward, you're going to have a tendency to lose that arch is going to decrease. So you want to maintain that arch with each step that moves forward. So that's your second step, paying attention to your pelvic tilt position with either the leg going back or the leg going forward, depending on your unique analysis findings.